Kliptown holds a very special place in our country's history. It became a town a year before Soweto, and more importantly was the host of the Congress of the People in 1955. This gave rise to the Freedom Charter, which is a core document of our constitution. In there, our people's demands of freedom are enshrined. We returned to Kliptown 58 years after the Freedom Charter was adopted, as well as 20 years since the birth of our celebrated democracy.
This epidemic has the potential to bring us closer together. We are responding as a united nation to a common threat. This national emergency demands that we cooperate, that we collaborate, and that we take common action. More than that, it requires solidarity, understanding, and compassion.
As news of the virus spread across the world, we began to worry about what this meant for Kliptown. More and more was being spoken about how close proximity meant the transmission of the virus. Recommendations from World Health Organization, the Center for Disease Control, governments across the world began giving recommendations of distancing, of isolation if you had symptoms, of washing hands regularly, of avoiding tight common spaces. As we listened, our hearts sank, knowing that none of these were realistic in Kliptown, where toilets were shared and water sources were communal. In Freedom Charter Square, squatter camp, it's common that 7 households share a single toilet. None of us at 1955 have a medical background, but we began reading, and we read voraciously about virus loads, about rates of human-to-human contact, about human-to-surface contact, about infection rates, what carrier spreading meant, what vector spreading meant, understanding the difference between these two, thinking about the trucks that come in to clean the toilets and how they go from community to community, about virus shedding through aerosol droplets in poorly ventilated areas and what this meant in the tight chemical toilets, about droplet sizes and data from epidemics and from the early COVID experiences in other places. And we worried as we thought about all of this in the dusty streets of Kliptown, where already people had lungs irritated by burning fuels and poorly ventilated dwellings, where people's health was already compromised by chronic hunger and by a lack of regular medical support. Though much of the literature talked about surfaces not being a high risk, this didn't hold true for places like Kliptown, simply because the number of people touching shared spaces is so much higher. And we identified the toilets as a high-risk place of transmission. Going to the toilet meant touching surfaces, doors, handles, seats that had been touched and touched and touched.
Manibonga bafethu, for now in really Kliptown kune-challenge of which abantu abakayibheki ngendlela engakhona. La eKliptown mfowethu since sikule squatter camp, development is slowly, truly speaking, is slowly. As ubona nawo ama-service asinawo la, asinawo ama-service. Ungastarta nje ukubheka nje kwabafowethu abasanitize ama-toilets. It's new to us, that thing, because into engakange sixelelwe ngayo sithishwe ukuthi mase kufika like ama-social department akavisite kwi-community bawuthi abantu bakithi you need to do this and that and that. You understand, ukukhuthaza abantu especially kwi-flag efana ne-squatter camp. But those things asizitholanga. sine-challenge eblinding yama-toilet, sine-challenge yamanzi, especially with the Covid-19. And they really matter that it cracks our head indaba ye-ambulance. Ngikwatile bangilana ndifike kimi namhlanje. We tried to get the ambulance yesterday, of which abantu bakhona bafone ngabo-6, ngafika ngo-8 nami ngayifonela i-ambulance. Only to kunikezwa ama-reference number, kuthi hayi izoze i-ambulance, waze washona umuntu izoshonela endlini. Amthoba ntoza yesterday. Ezwe ukuthi nokuzwa nawo apha kunabantu abavele bawe yini. Yeah, we know ukuthi vele it's difficult to expose umuntu ukuthi hayi now lo muntu sekabulawe yi-COVID what you understand, because iyayibona abantu sebabuye manje bafuna ukudegrade abanye abantu because ubandlele sifo futhi laa nto yana ikhethe bani yethu sonke, you understand. But really this thing ifikile Kliptown ngoba sesinabantu asebashonile just in this month abayi-3 including lo madala bavele bawe boom. Nayo madala masifika kuyokhala ngepain ekwi-chest up until aze lose umphefumulo. No ambulance ema-attendayo. When we try to get our counsellor, you can't find the counsellor ukutshela ukuthi hayi ifone is doing this and that, you understand. It's painful for the community. Akhona abantu abakhona ukukhansela laba abantu abashonelwe. Yeah, to come to that issue ama-toilet, if you know, ziyazi ama-toilet akhiwe for i-safety mnganami. And then understand that chief yami, if you leave the toilets open, it's a highly risky for our children. But what we specialize in kakhulu thina kubantwana ukuthi abantwana bayuse i-bucket. Then you can take that bucket in it because you can't put your child, especially that chemical ethelwa lapha etoilet. Beside the COVID, the chemical is dangerous. If really government can push this thing here reblocking, because we know that once we end the reblocking, we can take these toilets beyond.
Yabo inkinga yalapha eMarikana yokuqala ngizoqala ngayo ile ukuthi sisebenzisa izinyoka yabona asinagesi njengaseMandela Square. Bona Mandela Square baphila kamnandi kanjani manje. Sesiyawufuna nathi lo gesi lo wangapha ngoba yabona manje ngibuye kubuyisa i-TV yami ishile ngawo la madrata lapha. Yabona masingaba thola ama-toilet aflashayo sithola ugesi we-right, I think kungaba ngcono singaphila right njengabanye abantu yabo.
Batla matlo ha tsela mangwele ke batla matlo le motlakase ke mo re dula Kliptown from 1986 ke di tsofalla bona so bile ona le corona e tla beng ke ska ka hlola ke le bona.
Work really hard at creating a culture of horizontal collaboration. This began with the idea of our knowledge sets and of pushing back at the status quo of academic knowledge being more valued than everyday knowledge within the community. It also touches on balancing issues around gender, around race, around white privilege and the opportunities and the access that sometimes gives me that other members of the 1955 team don't have. The other issue that it brings is around money and economics and the role that plays in our society of how we are valued as individuals based on the money we have or don't have. And this is something that we've faced with our COVID initiative in Kliptown. We came up with the idea that we needed to do this initiative, but immediately we're faced with how are we going to pay for this? And one of the things that was really critically important is how the members of our crew could rely on having a stipend continuously that they knew they would receive regularly and could count on, so that they had that emotional and economic stability. We started 1955 as a social enterprise. This means making a nonprofit company that is socially, economically, and environmentally sustainable. This means moving away from the model of relying on funds from outside sources, like the way an NGO works. But suddenly, with the initiative for COVID, we were faced with how do we pay for what it is we see that needs to be done. None of us wanted to ask for donations for what felt to us like a handout. One of the core principles of 1955 is this fierce desire that it be an organization that is deeply rooted in Kliptown, it's about Kliptown, it's from Kliptown, and it's generated by Kliptown. And this means economically as well. And so it's always been part of our discussion of how do we do this? What can we create that comes out of Kliptown that not only addresses the projects we want to work on, but that generates the income we need to do that. So in telling you about the economics of our COVID initiative, there are basically 3 phases that we've been through. The first was the startup and treating it like a pilot project and identifying the need and identifying what the resources are that we have and how we're going to share them. And we define those resources as time, as skills, as different knowledge sets, as different access to infrastructure, to physical work on the ground. And we all contributed in the ways in which we were capable. We piloted this project with our own resources. And that was really difficult at times, but it was also really empowering. And it's taught us that we can come up with an idea and we can just start working on it. And for this project, that included developing and initiating the strategies, designing and developing the PPEs, or personal protective equipment, to keep our crew safe, and identifying the most vulnerable people in the community. As well, it was sourcing and getting supplies during lockdown and how to navigate that. The core 1955 crew, which is Thabang, Ginger, Robert, and Kristen, all contributed the resources they had, whether it was their network of friends, whether it was the knowledge of the community, whether it was Wi-Fi time, whether it was money. It was all pooled. And it's really important to acknowledge that it was all done within a context of friendships and relationships that stretch back for years and years, that we've collaborated and built a sense of trust and of knowing each other and relying on each other. None of us have huge salaries. Ginger is a resident artist at the Bakomo Gallery in Walter Sisulu Square in Kliptown. Thabang hangs artworks in galleries and museums across Johannesburg and Pretoria. Robert is a tour guide and community activist. Kristen is an adjunct faculty member at Athabasca University in the School of Architecture. But we pool these resources and we share them. Since the end of February, we've each taken home an equal stipend every 2 weeks. And the rest of our monies are put into a fund that pays for supplies and airtime and paying the people who have joined our crew to assist with the spraying and sanitizing of the toilets and the distribution of the tissue and soap for hand washing. But soon we faced the reality that there was was so much need, and how were we going to sustain this? And so we had to make difficult decisions about not expanding the project beyond what we knew we could support. We had to honor the commitments we made to the grannies, to the vulnerable people in the community, that we could continue doing this over the long term. But even this meant more funds than really what we had. And so this became the point that we knew our project was effective and would contribute to the slowing of the spread of the virus in Kliptown. But we needed to sustain it over the long haul. We started the project thinking this would be a month or two, and we've now been doing it for 6 months. And so the second phase became how to maintain this. And it was at this point that we turned to fundraising. We set up a website that included what we did, what the project was about, how we did it. We created a fundraising platform that allowed people to donate at different levels. We established an Instagram site to allow people to follow what we were doing. We wanted people to be able to contextualize the COVID initiative in Kliptown within the larger context of 1955 as a company with a totally different set of goals and ideals. And we wanted to distance ourselves from the stereotype of an African project that needs help from the West. So to do this, we set out with the idea of creating across all of our platforms a sense of collaboration versus donation. And the reality is, we got very little money. So we got feedback, and we reevaluated, and we compromised to the point that we felt comfortable with. We added a donate button to our website, which we'd been avoiding. We became more overt in asking people for money, in simply stating that we needed the money to keep the project going. And money trickled in. And it was exciting as we realized we could pay our bills at the end of each month. But it was also heart-wrenching that we couldn't grow the project in the way we envisioned and in the way the community needed. It also reinforced to us that our original idea of 1955 as a social enterprise that makes its own way was the direction that we wanted to go. And so this began phase 3. And phase 3 was, how can 1955 earn the money that it needs to keep this project going? We came up with the idea of sanitizing facilities, and we put in quotes. Those weren't successful. We looked for and wrote proposals for grants and have had some success with that. But most exciting, last week we had our first paid job as 1955. We created 5 short films and a panel discussion between Kliptown residents and students via Zoom. The students are in programs at TU Berlin in Germany and Wits University School of Architecture and Planning in Johannesburg. This proved so empowering. It was creative. We negotiated our copyright. We worked out IT difficulties of how to broadcast from Kliptown. This was how we wanted to move forward. We wanted to earn our way. But the reality is we've come to realize we need all of these. We need multiple streams of monies coming in, whether they be from ourselves, from the fundraising, or from what we produce and market and sell.
Samonani, my name is Thabang Nkwanyana.
Sanibonani, good morning. My name is Shai.
Sanibonani, igama lami Kristen Kornienko.
Sanibonani, igama lami Mahlamvu.
Igama lami Demigod.
Igama lami
I've been a community activist and a tour guide.
What I do, I'm a visual artist and I also install art, and I'm very passionate about fashion photography. Yeah. Kliptown is not on a good state, if I could say, in terms of like, we have challenges in terms of like development, lack of sanitation, running water and stuff, and yeah, Kliptown is not in a good state. The buildings around Kliptown are over 50 years and they're starting to fall apart now since they've been here for more than 60 to 70 years.
The state of Kliptown is deteriorating. Yeah, it's disheartening more when your situation as a Kliptown. It's not good. It's not good. We like the divide. The situation not far away from where now, which is now we overpay money. You find the situation with the Agnasim Brinking. Yeah, so it's
what I would like to see happening in Kliptown, I would really love to see Kliptown being independent and doing things on their own, because like I'm saying, for years we've been in Kliptown but we never seen anything positive unless we Kliptownians will start thinking positive and acting positive, because waiting for a government will never change.